Down below the wards, the comings and goings are constant. There are meals, meds and masks, the quantities swelling as the NHS is mobilised.
The phone's been ringing every 5 minutes or so. We're sending stuff up to wards and all around the hospital.
At 18, Imogen Blake only started working here as a medical secretary 2 months ago. With all non-essential appointments on hold, she's switched to helping distribute supplies.
I think it's such an amazing time to just join the NHS. I mean, obviously I didn't know this was going to happen 2 months ago, but I feel really proud to be working here, and I'm really glad that I am here. And people say, oh, you're working at the hospital now, it must be a weird time to be there. I think, yeah, but it's really exciting, and it's really interesting to see how the hospital copes with this sort of situation. It's a big learning curve.
And that rapid learning process takes many forms here. Just as people are being redeployed, physical space is being redesignated.
We've seen patients here this afternoon turning up with suspected coronavirus, and this hospital has now divided its A&E department with a whole half specifically for people who believe they may have the virus. That's the kind of thing that's going on in hospitals across the country.
Down on level 2, what was a stroke ward has been converted into a specialist COVID-19 one with up to 80 beds. Helen Benfield was the matron or senior nurse chosen to run it.
My clinical director volunteered me because I've got acute medical skills, and actually I was really happy to do that.
You're not apprehensive on taking on that responsibility?
No, of course there's apprehension. I think we're all anxious. The response of staff volunteering to work on that unit has been incredible. A lot of people have said that that's where they'd like to be. They want to do their bit. They want to be able to help the patients, want to be help in this crisis.
The serious cases, people who can no longer breathe unaided, get transferred to the intensive care unit, where doctors fear the awful choices about who gets intensive care that this pandemic could bring.
I've reflected on that both professionally as a doctor and individually as a potential patient. As intensive care doctors, we frequently in our normal working make decisions about the appropriateness or otherwise of the care that we have to offer. What a pandemic situation like this does potentially takes us to the point where we're having to make decisions simply on what capacity we have and how that relates to the demand that's presenting to us. That's not a comfortable situation for any doctor or any healthcare worker to make, and we hope that our preparation and our planning prevents us from ever having to make those decisions. But if we do, we will have to, but it won't be done simply on the basis of age or any single variable. It's going to be broadly based upon our ability to do the greatest good for the greatest number of people.
We're not going to film in this specialist coronavirus ward. Patients' own relatives only get very limited ability to see them in there. There's just too much going on. We wouldn't want to get in the way. But the hospital can scale up even further. Having created 60 beds here and another 20 in the intensive care unit, they've got a plan, if necessary, to devote up to 200 beds to treating patients suffering from the virus.
The hospital did film these shots for us inside the ward. From a trickle of patients 3 weeks ago when they opened, they've now treated hundreds. They reckon they're about 10 days behind the hard-pressed London hospitals. 14 of the patients here did not survive, including 4 who died on the day we filmed. And those looking after them understand that this toll can only grow now.
We have patients die on wards and units. It is distressing, it is upsetting, and part of my role is to make sure as nurses and the healthcare support workers, we are enabling those patients to have a most dignified death that they possibly can. We know there's a reduction in relatives visiting, so I think it's even more crucial for our role to make sure if patients are dying that we are there with them and caring for them.
They call this Maternity Hill. Here and in many other parts of the hospital, protective equipment is not worn, but anyone in close contact with patients does use it. Some staff have already fallen ill. Others have had to stay at home in isolation because a family member has shown symptoms. There's clear frustration among medics that there isn't a better system of testing for the virus.
Our workforce is being severely compromised by people either having to self-isolate at home because a family member may have coronavirus infection or because the healthcare worker themselves does. Being able to determine conclusively whether those people are truly infected or not would undoubtedly result in the faster return to work of a great number of healthcare workers, and that would make it much easier for us to respond in a way that we'd like to respond. So the sooner that is able to be spread out and distributed and ramped up so that all healthcare staff or their family members who are requiring them to self-isolate and therefore not be at work, the better. It can't come soon enough.
The mood here, I suppose you could sum up as one of anxious anticipation, of people having a sense that this hospital, like so many across the country, is about to undergo a great trial. They've done so much to prepare for it, but you really feel that many people would just like to get it over with now.
And across Salisbury and the country, people have come out to applaud the NHS and support its people in a variety of ways. That's caught the medics by surprise, but in a good way.
I find it really, really overwhelming. We feel we're doing our job. This is a job that we do every day. So it does feel all a little bit surreal that there's that support out there.
I've been overwhelmed actually by the amount of contact people have made with me and the offers of help that have been made to me and my family to keep us going through what's likely to be a difficult period. To see the national community response to the NHS response to this is really, it's very moving and heartwarming, to be perfectly honest.
Well, you really are carrying the hopes of the nation, aren't you, in that sense?
If you say so.